Hello, my name is Morgan Kirby, and this is my philosophy of health and wellness. I do have my notes in front of me, and then I have an excerpt from the textbook that I just wanted to read to start out. So it says, the sociology of health, illness, and healthcare has changed dramatically over the past few decades. The field was started primarily by sociologists who worked closely with doctors, taking doctors' assumptions about health and healthcare for granted, and primarily asking questions that doctors deemed important. By the 1970s, however, the field had begun shifting towards a decidedly different set of questions. Some of these new questions challenged doctors' assumptions, whereas others focused on issues that lay outside most doctors' areas of interest or expertise, such as how poverty affects health or how individuals develop meaningful lives despite chronic illness. And then the author talks about how he entered graduate school during the shift, and he said, I was drawn by the opportunity to study how health and illness are socially created and defined, and how gender, ethnicity, social class, and power affect both the healthcare system and individual experiences of health and illness. As a result, over the years, I have researched such topics as how medical values affect doctors' use of genetic testing, how midwives and doctors have battled for control over childbirth, and how social ideas about AIDS affect the lives of those who live with the disease. And lastly, he just talks about how through his time he's learned so much more about the sociology of health and wellness. And I feel the same way about this class. I was in such a weird place whenever the global pandemic started. And that's honestly one of the reasons I signed up for this class, because I felt like I had so much anxiety and was struggling to find peace with the whole situation, that I don't know, I needed to learn more about the healthcare world. And so for me, being a sociology major, I wanted to learn more about health, illness, and healthcare, mental illnesses, chronic illnesses, the healthcare technologies, professions of medicine, how healthcare looks different here than it does everywhere else. And then coming from a family of medical professionals, I felt like I sat at the dinner table and didn't know what everyone else was talking about. And so I wanted to educate myself more in order to be able to understand what was really going on in our world, what was really going on in the lives of other Americans, especially during this pandemic. So I know that the rubric said something about talking about like healthcare costs and insurance coverage and what we've talked about this whole semester. So I'd like to talk a little bit about like the things that I feel like I've learned about, and then I would like to talk about some personal experiences that I feel like do relate back to the class that add to my philosophy. So we talked a lot about healthcare costs and insurance coverage, and then I think one of the main things I really want to talk about is healthcare in the U.S. Versus healthcare around the globe. So I did take a lot of notes on this. So it blows my mind that with healthcare in the U.S., we honestly have to worry about people who are uninsured not having access to the medicines that they need, the services that they need, everything like that. So, personally, I have had 3 trips to the ER, 2 trips to the ER, and then several doctor's visits over the past several weeks. And due to COVID, my dad, who is my insurance, like, has me under his insurance, he lost his job at the beginning of COVID, and even though he's recently found a new job, it takes 3 months for the insurance to start. So being in the ER twice in 2 weeks and receiving bills for $4,000 a piece blows my mind, but also opens my eyes to how hard other Americans have it. I could not imagine going to the ER because of COVID and leaving with a $4,000 to $5,000 bill just to be told, hey, you got a pandemic because you sat beside someone who had it and you didn't know. I think it's really sad that other countries offer so much, yet the United States offers us so little when it comes to healthcare. I also think it's really crazy just talking about healthcare costs and insurance coverage. We did an assignment that talked about medical tourism on a forum and how people would literally travel to different countries to have a procedure done just because the price is so much cheaper compared to America. And that's actually incredible when you think about the fact that people are willing to pay for a flight, a hotel, and the procedure, and it's still likely less than what they'd be paying in the United States. And oftentimes it's a procedure that they need done and just can't afford. I think that this class was also important to take during a time where I didn't have insurance because it really did open my eyes to a lot of things about healthcare in the United States. So just going back to Unit 1 and Unit 3. So in Unit 1 we talked about health, illness, and healthcare. And then Unit 3 we talked about healthcare settings and technologies. And I think that both are equally important when you think about the current pandemic and what our world is going through. So I think we're probably on like month 9 or 10 of the pandemic, and they are already coming up with a vaccine, and that equally scares me and provides me with peace because I think that coming up with a vaccine that fast can be dangerous, but I think it's able to be done that fast because of the healthcare technologies that we have available to us. So just going off of all the resources I've read this semester, how I looked at chronic illnesses deeply and looked into people that live with illnesses that we really don't know much about, modern illnesses, just everything I have all together and health-related measures. I think that I've been able to take my personal experiences and the education that I've received this semester and really get a more well-rounded opinion on health and wellness in the United States. Looking back into our textbook, we hear a lot about illnesses, a lot about technologies, bioethics, everything, and I just really feel like this class was able to provide me an understanding. So when you look at how my understanding has changed, I really liked how you said, how has the student's understanding changed, remained the same, or has cracked the door of further intellectual curiosity within the field of sociology and health and wellness? Coming from a family of medical professionals, as I've said, I think this has inspired me to really not just sit at the dinner table and not know what's going on, but to join in on conversation, to look deeper into health and wellness, look deeper into healthcare coverage and insurance coverage and how so many Americans go without. I think that it only takes one person to start the change, so why not be the change? I really did truly enjoy this class this semester, and I was able to learn a lot about health and wellness in general. And I think my main area of concern was on insurance coverage and healthcare costs. So I did enjoy this class, and I appreciate you taking the time to listen to my philosophy of health and wellness.